privacy.
Coronary artery bypass surgery helps to restore blood flow to the heart. It is sometimes called coronary artery bypass grafting. The heart is a muscle that pumps oxygen and nutrient-rich blood throughout the body. On the outside of the heart, large blood vessels called coronary arteries wrap around the surface and deliver oxygen and nutrients to the heart so it can do its job. Normally, blood flows easily throughout the heart and to the rest of the body. But over time, your heart can become damaged. A fatty substance called plaque can build up in the coronary arteries. Plaque causes the arteries to narrow, reducing or completely blocking the amount of blood that can get to the heart. When the heart doesn't get enough blood and oxygen, parts of it can become permanently damaged and even die. This can lead to chest pain called angina, heart attack, and stroke. During coronary artery bypass surgery, a blood vessel from your leg, forearm, or chest is removed and used on the surface of your heart to create a new route for blood to flow. It will bypass the clogged portion of your coronary artery and restore blood flow to your heart, allowing it to once again receive the oxygen and nutrients it needs to function. In the operating room, you will be given medication to help you sleep called anesthesia. Little discs called electrodes are attached to monitor you. And an IV provides you with medication, anesthesia, and fluids. Once you are asleep, a catheter is used to collect urine, and a breathing tube helps you breathe. A heart-lung machine may be used. Coronary artery bypass surgeries usually last from 3 to 6 hours, depending on the damage your cardiac care team needs to repair. Coronary artery bypass surgery will improve the health of your heart and improve its ability to pump blood throughout your body, making you feel better overall. It is finally here, the day of your heart surgery. To be completely prepared for your surgery, your cardiac care team will give you a list of instructions to follow. Here are some examples. The morning of your surgery, shower and shampoo thoroughly with antibacterial soap. This will kill any bacteria on your skin and reduce the chance of infection. Don't eat or drink anything the morning of your surgery. If your mouth is dry, you can rinse it with water, but make sure you spit it out. If you have been told you can take some of your medications the morning of your surgery, try to take them without water or with as little water as possible. Only take the medications that your cardiac care team has said is safe to take before your surgery. Do not take anticoagulant medications such as Coumadin. When you arrive at the hospital, you will register and be taken to a pre-op room to get prepared for your surgery. You'll change into a hospital gown when you arrive at the hospital. Remove any personal items like your glasses, contact lenses, or dentures, and give them to your family member for safekeeping. At this point, a member of your cardiac care team will prepare your surgical site. An IV will be started to give your body fluids, medications, and anesthesia during surgery. As with any surgery, there are risks. Make sure you understand them. If you have any concerns, ask. Your cardiac care team wants you to feel comfortable in their care. If you haven't already done so, tell your care team about any allergies to food, medications, test dyes, or latex you may have, as well as any vision or hearing problems. Once you are comfortable, you will be asked to sign a consent form and then taken to the operating room.
228, code BERT 228,
Heart surgeries usually last from 3 to 6 hours, depending on the damage your cardiac care team needs to repair. Once your surgery is finished, your cardiac care team will let your family know how you are doing, and you will move to intensive care. Immediately after your heart surgery is complete, you will be taken to intensive care.
I woke up in the ICU, and first thing I can remember, they're taking out the tube. It hurt, but it went away.
When you first wake up, you may feel groggy and confused. Some patients say they feel thirsty and cold. The sound of the machines beeping and the feel of tubes and wires connected to you can make you feel anxious. It is important to stay calm and relaxed. These help monitor how you are doing. If you can't talk because your breathing tube is still in, your cardiac care team will ask you yes or no questions. Answer by nodding your head. And don't worry, your breathing tube will be removed when you are wide awake and can cough and breathe on your own.
The biggest thing about the ICU part was the ventilator, just being, for them removing it and just feeling like, okay, this is one step to recovery.
It's also normal to feel some level of pain and discomfort after surgery.
He's in a chair.
Tell your cardiac care team when you are in pain and how much pain you are feeling. They can help you manage your pain.
When you're coughing and breathing deep, what would you rate your pain? 0 being none, 10 being the worst you've ever had.
Normally it's like 3 or 4, but when I cough or breathe deep, it's definitely like 6, maybe 7.
Okay.
Managing your pain properly will allow you to feel comfortable enough to do the things you need to do in order to recover. Some pain will go away with time and as you begin to move. Other pain can be relieved with medication given orally or through your IV. Intensive care generally lasts 1 to 2 days. During this time, nurses, doctors, and other hospital staff closely monitor your progress. They can answer any questions that you or your family members may have. As you get stronger, your family can visit. You need time to rest, so these visits may be short and limited to only a small number of family members. When your cardiac care team feels you are ready, with help, you will start to move and do other activities to help your recovery. With help, move from your bed to a chair. You are at an increased risk of falling, so for your safety, always follow your care team's direction when moving. Keep your legs elevated when sitting in a chair.
Hi there, Mr. Jones. I'm gonna do some breathing exercises with you. Would you like to?
To strengthen your lungs and prevent lung infections, you will do breathing exercises called incentive spirometry and controlled coughing. Perform these exercises as directed, but expect to do them about 10 times every 1 to 2 hours. Incentive spirometry helps you breathe easier by helping you breathe deeper. Controlled coughing opens up the tiny air sacs in your lungs and helps get rid of any extra mucus. A pillow or teddy bear to hug while you do your coughing exercises can relieve some of the discomfort you may feel because of your incision. When your cardiac care team feels you are ready, you will progress from intensive care to a step-down level of care to continue your recovery. have been through major surgery. It is normal to feel some level of pain and discomfort as you recover.
Can you rate your pain for me on a scale of 0 to 10? About an 8. Okay, well,
When you are in pain, tell your cardiac care team. Managing your pain properly will allow you to feel comfortable enough to do the things you need to do in order to recover.
Hi. Hello. How are you?
There are
Rome?
many
And there's
reasons
Peter.
after
You can
surgery
say
that you may
hi.
have
How are
pain.
you doing so far?
Because a breathing
Good.
tube
How's my
is
nursing?
used, some patients have a sore
Good.
throat.
Very good. Thank
You
you.
may notice soreness
You know the
caused by
plan is for you
increased
today?
activity as you start to get up and move around. And you may have
Sounds good,
discomfort
right?
in the incision areas in your
Let me know if
chest,
you have any
legs, or
questions.
arms.
Okay. Thank you so
The
much.
incision in your
Anything
chest from
you
heart
need?
surgery
No,
is
we're
called a
good.
sternal
Okay.
wound
Make sure you
because it runs down
watch.
the middle of your chest
Okay.
bone or sternum. It is common for your incision areas to feel tight, sore, or numb, and may look bruised or slightly red in color. This incision pain will decrease as time goes by, but it will take about 6 to 8 weeks for these areas to heal completely, so be patient. You may be given pain medications through your IV with a patient-controlled pump or as a pill or liquid. Take your pain medications as prescribed. They will help you to get active and get out of the hospital.
It's very important for you to share with your nurse that you're having discomfort. Don't try to be tough and I can get through this. It's important we have medications that are ordered specifically for pain to help you to get through your daily activities of living.
You are the one in pain, so you know your pain best. Your cardiac care team will ask you to describe and rate your pain. Be as specific as possible. Where is the pain, and what does it feel like? Rate your pain on a scale of 0 to 10. 0 means no pain at all, and 10 means the worst pain you can imagine. Some pain scales have pictures as well as numbers to help you show your cardiac care team how you feel. If you are already getting pain medications but you are still in pain, tell your cardiac care team. You may need to have your medications adjusted. If you still feel your pain is unmanageable after receiving your medication, talk to your cardiac care team about other options for pain control. Changing positions often, elevating your legs, and practicing relaxation techniques can also help to relieve your pain. As you become more active and heal, your pain will gradually decrease and go away. Don't let pain get in the way of your recovery progress. If you are in pain, take an active role in your pain management. Tell your cardiac care team and take your pain medications. They are there to help you recover and return you to your active lifestyle. After heart surgery, it is important that you take an active role in your recovery. One way to do this is to perform breathing exercises like incentive spirometry and controlled coughing. These breathing exercises help strengthen your lungs and prevent lung infections like pneumonia. Perform these exercises as directed, but expect to do them about 10 times every 1 to 2 hours. Incentive spirometry is a lung exercise that helps you breathe easier by helping you breathe deeper. Use an incentive spirometer and take slow, deep breaths.
Incentive spirometry is something that just kind of helps to keep your lungs open and working well.
At first you can't do it a lot, but then days go by and you see the line goes up and higher until you finally meet your goal.
Your healthcare team will set goals for you and will monitor your progress. To use an incentive spirometer, set the indicator on the outside of the spirometer to the level your cardiac care team has recommended for you. Sit up as straight as you can. Breathe out and put the mouthpiece in your mouth. Take a breath in slowly. Try to keep the marker near the indicator on the outside of the spirometer. Hold your breath for 5 seconds and let the marker fall slowly back down to the bottom of the spirometer. Breathe out. Perform this routine as often as your cardiac care team tells you to. As your breathing and lungs improve, your cardiac care team may set new goals. Simply move the indicator on the outside of the spirometer to your new goal level and continue to exercise your lungs.
Now, it's going to cause some pain when you cough, so we give you this pillow and you hug it when you cough and it'll split your chest, make it a little easier.
Another important lung exercise you can do after heart surgery is controlled coughing. Controlled coughing opens up the tiny air sacs in your lungs and helps get rid of any extra mucus that built up during surgery. Sit on the edge of your bed or a chair if you can and wrap your arms around your stomach. This may be painful at first because of your incision. A soft pillow or teddy bear to hug while you do your coughing exercises can relieve some of the discomfort you may feel. Slowly breathe in through your nose. Lean forward and quickly cough 3 times. Hold your arms against the pillow as you cough. Then breathe in gently through your nose. Repeat this exercise as often as your cardiac care team directs you to throughout your recovery. Using these 2 breathing exercises together, first by doing incentive spirometry and then by controlled coughing, you can help to speed your recovery and improve your health.
There's many chapters in this presentation. I think it's almost
Increasing your activity level after heart surgery is an important part of your recovery. Being able to do some normal activities of daily living are the first steps you need to take in order to reach your overall recovery goals and leave the hospital. Begin by getting out of bed. Your cardiac care team will encourage you to get out of bed whenever possible. They will also teach you how to get up safely to protect your chest bone and incision. Until you are physically able, get help to walk from your bed to the restroom. With assistance, you can move from your bed to a chair to eat your meals, visit with your family members, and just relax. You may actually feel more comfortable sitting in a chair. For increased blood circulation, keep your feet elevated when sitting in a chair. If you need to, put a pillow under your legs to keep them raised. Do not cross your legs when you sit because it puts pressure on the veins under your legs. When you're getting out of the chair, hold a small pillow over your chest. Move to the front of the chair, keep your feet flat on the floor, lean forward, and push down with your legs to stand up. Every time you move from your bed to the chair and back again, do so safely. Especially for those first few days, you will be weaker than normal and need help. Don't be afraid to ask a nurse or other hospital staff member to help you. The nursing staff may also show your family members how to properly help you get out of bed. Avoid putting pressure on your breastbone. Do not use your arms and upper body strength for assistance. Any pressure and strain on your incision site may cause complications. Instead, roll onto your side and use your legs and elbows to push yourself up. Gently put weight on your legs and stand up, holding on to your bed handrail until you are steady on your feet. As your recovery progresses and you are able to do more, you will start to walk around your room. At first, you will need assistance from a nurse or therapist, and possibly a device to help your balance. As you improve, you will need less assistance, and eventually you'll be able to get around by yourself. Always wear slippers or socks that fit well and have non-skid soles. Take short steps and rest when you need to.
Okay.
Pretty soon you will be able to go longer distances, like taking a walk down the hallway. Just remember, you have to come back, so don't overdo it. Rest if you need to. When your cardiac care team tells you you're ready, you can start doing physical exercises to strengthen your legs and upper body. You may perform these exercises several times a day. As you recover, your cardiac care team will increase the amount of activity you do each day to further strengthen your heart and body. Be confident that your cardiac care team will only ask you to do an amount of activity that is safe for you. They will not put you in harm's way. As you recover from heart surgery, gradually increase your activity level in a safe and supervised way in order to reach your recovery goals. Be active, get out of bed to walk, do your exercises, and when the time is right, you will be discharged from the hospital to continue your recovery at home. Recovering from heart surgery can be difficult, both physically and emotionally. During your hospital stay, you have gone through the stresses of the actual surgery and now have the anxiety of recovery ahead of you.
One day I woke up and I'm just like, I am so sad, I am depressed, I am anxious.
Well, after surgery, being home, I experienced a lot of sadness and depression.
After a serious event like heart surgery, feelings such as sadness, depression, irritability, and anxiety can be common. You've been through a stressful event. Being in the hospital and away from the comforts of home, combined with a lack of sleep, new medications, and the change from your normal routine, can all add to those feelings. The good news is that all of these feelings are common and should go away with time. But do not ignore how you're feeling. You don't want depression, anxiety, and any other emotions you are feeling to get in the way of your recovery. Talk to your cardiac care team about ways you can cope with your emotions while you recover. Prayer, meditation, and moments of quiet relaxation can also do wonders for your spirit. And just because you're in the hospital does not mean you can't get this kind of spiritual guidance. Many hospitals have a chapel available. Ask about chaplain services where the chaplain comes to you, if that's easier.
My priest has been to see me, my deacon's been to see me, I've been back to church now once or twice, and that's an important part to me, to my recovery, and just to know that there's someone looking over me.
And of course, talking to family members, loved ones, and friends can always help. Be honest about how you're feeling. They love you and only want to help. Sometimes just getting your emotions out can relieve the stresses and anxiety you're feeling. Recovering from heart surgery can take time. One thing that can help you through the frustrations of recovery is setting reasonable goals for your progress. Completing your breathing exercises, getting out of bed and walking a little, taking your medications, and performing activities of daily living can all be examples of goals you can set. When you reach a goal, feel positive. This is a job well done. When recovery does get frustrating and overwhelming, take some time to highlight all the successes you have had during recovery, no matter how small. Keep focused on working toward discharge and moving toward the next step of your recovery. Heart surgery is scary. It is common to feel many different emotions during your recovery in the hospital. The important thing is not to let those emotions get in the way of your recovery. Reach out for support to deal with your emotions in the way that is best for you, and begin to look forward to each successful step you take during your recovery. Your progress may amaze even you.
You know, we talk about the heart being the center of our emotions and our feelings. So after having major heart surgery, it's not real surprising that there would be damage to that part of your heart too that needs to be dealt with.
It only was a couple of weeks until, I felt much better, and today I can say that I'm pretty much back to my normal self.
I'm not sure. It was the.
It should be pretty close. Let me see
Okay.
if there might be one more.
Hey guys, are you ready to go home?
This is more for like discharging,
Yeah,
but
okay,
I
well,
want to have
a
everybody
few
kind of
last
watch
minute
it just so
discharge
you can
instructions for you.
Perfect. Thank you.
When it's time for you to leave the hospital, members of your cardiac care team will visit you. They'll go over specific guidelines to ensure a healthy recovery.
We educate them regarding their medications, what they can expect when they leave the hospital, and also prepare them as they start their rehabilitation into leading a more healthy lifestyle.
You will get a written discharge plan designed specifically for you. Your discharge plan will include information on pain and discomfort, incision care, diet and nutrition, and physical activity, including what you can and can't do over the next few weeks. It will detail all of the medications you are prescribed, including how much and when to take them. Pay special attention to this list. You may have been prescribed new medications, while some of your old medications may have been changed or deleted. Don't take any medications that aren't on this list before talking with your healthcare provider. If you have been prescribed an anticoagulant medication like warfarin, you will be tested to make sure your dosage is correct before you leave the hospital, and you will be given specific instructions to follow. Also, your discharge plan will include when you can resume your normal activities like returning to work and driving. Note the date of your follow-up appointment on your discharge plan. It will probably be scheduled for a few weeks after you return home. This is a lot of information. Don't be afraid to ask questions.
So, do you guys have any questions?
Yeah, actually, when can I pick up my son?
Well, there is a way.
And make sure you know who to call if you have any questions once you get home. It may help to have a family member or friend with you to help remember all of the information given. Have a family member or friend drive you home. In the car, be careful around your incision area. Use a pillow or other soft object between your chest and the seatbelt to cushion any direct pressure on your incision site. A lot of people feel more comfortable riding in the back seat.
As I left the hospital on my way home, I had my heart pillow with me. That was nice to have it with me. A part of the hospital came home with me.
You've been through a lot and are ready to leave the hospital. At discharge, make sure you understand your instructions clearly in order to continue your recovery at home.